Welcome to the Slop Farm. Enjoy the video.
You begin by prepping and locating key palm points so your work is precise. First, warm and clean both hands. Warm tissue responds better and reduces discomfort. Once done, use gentle palpation to find the heart center just below the middle finger, the diaphragm point near the base of the thumb, and the lung area along the outer palm. Make sure to set pressure expectations. Start light, test the recipient's feedback, and maintain steady contact as you prepare to work each point. You now apply targeted pressure with controlled timing to stimulate circulation and nervous response. Start with your thumb pad at the chosen point. Press steadily for about 6 to 10 seconds, then release briefly. Repeat 3 to 5 cycles to encourage relaxation. Make sure to angle pressure toward the underlying bone to create effective load without sliding over skin, and synchronize with the person's breathing to reduce guarding. If an area feels sharp or overly tender, you finish by smoothing and calming the palm so tension doesn't rebound. After targeted cycles, perform light sweeping strokes across the entire palm for 30 to 45 seconds to disperse metabolites and soothe nerve endings. If pain increases at any point, stop immediately, then reduce pressure by about half, reapply gently, and ask for a comfort check. Make sure to recommend hydration and 10 to 15 minutes of rest, and advise seeking professional assessment if sharp or persistent pain remains after the session.
Thanks for watching. Consider subscribing if we helped you today.